Well, good morning, everyone. Thank you to all of you for being here this morning for what promises to be some very encouraging words from our Minister of Health and Long-Term Care, the Honourable Deb Matthews, whom I welcome here this morning. Thank you so much for joining us. As well, the Honourable Steve Peters, who is also the Speaker of the House. Thank you, Steve, for making time today. We have a number of people in the audience. First, I want to acknowledge all of our staff who are around the circle. Thank you so much for being available, and then we're going to be relatively quick, so we know everybody has their obligations they have to meet. But we also have people here from the councillors from our county council, County of Elgin. Thank you for being here. And the warden of our county, Dave Mennell, is here. We have the mayor of City of St. Thomas, Heather Jackson Chapman, and a number of councillors as well. So thank you for being here. We have people who are in our foundation board who are important fundraisers, obviously, for our hospital, as well as our own board of directors. We have a number of special and important people from around the county and the city of London as well. So, and to our friends in the media, thank you so much for being here today. I am absolutely delighted to be able to welcome the Minister here today for her remarks, which, again, I know are going to be exciting and important, as they always are. And I certainly appreciate the opportunity to introduce to you this morning the Honourable Steve Peters, who has been a tireless supporter of this hospital, as many of you know, and has certainly done Elgin County and the City of St. Thomas well in his representation at Queen's Park, and to be elevated to the position of Speaker. Steve, we're all very proud of you, and thank you so much for being here. And if I can invite you up to say a few words.
Thanks very much, Paul. To the staff, thanks. This is an amazing hospital, and this hospital is special to me because I started my life in this hospital. My mom's over there, and she just told me today I was adopted. I love you, Mom, and this hospital has had a special place in my family's hearts for a long time. This is an amazing day for me because as I wind down a political career that has spanned 23 years, this will be my last formal announcement that I'm going to partake in as MPP. But I can tell you I couldn't think of a better announcement to be in attendance at as the MPP for Elgin, Middlesex, London. This is an amazing project that's going to be announced today because this has been the culmination of years of work. And it means a lot to me because I know how hard people have worked behind the scenes to make this a reality. I want to thank Deb, the Minister of Health, Deb Matthews, Premier McGuinty, and the Government of Ontario for their commitment to this hospital and what we're going to hear today. To Paul Collins and all the staff and the foundation staff, thank you. You know, we've got a long history of health care in this city dating back to the 1880s with the Michigan Central Railway and the Railway Hospital. You look over to the right over here and you'll see not Al Zacher, but you do see Al Zacher. Gee, Zach. But you see a gentleman by the name of Amasa Wood. And Amasa Wood donated the money for the first hospital in this city, which opened May 25th, 1892. It was added to with the development of the Memorial Hospital in 1924. And then the cornerstone for this facility was laid in 1952, culminating with the opening of this new facility in 1954. But this announcement today that the Minister is going to be making isn't just about this facility. It's about another facility that's played a very important role in our community for a long time, and that's the St. Thomas Psychiatric Hospital that its origins date back to 1938, but officially was used by the government during the Second World War and officially opened as a psychiatric hospital in 1946. This is where my own involvement in this project begins, and it begins back in the 1990s as the mayor of St. Thomas. And being involved in this project and seeing it through 3 different governments to the point that we're at today. I can remember, and many of you remember very well, going to the District Health Council in London back about 1994, and the District Health Council making the decision that they were going to close the St. Thomas Psychiatric Hospital and move everything to London. We got together as a community and we fought that, and we stopped that. We then saw a new government and the rise of the Health Services Restructuring Commission and its report in 1997. The key components in that report in 1997 were a new forensics unit to be built at the St. Thomas Psychiatric Hospital site. That project is underway. New mental health beds in Waterloo and Windsor. Those are completed. A new psychiatric hospital in London under construction. There's one piece of that jigsaw puzzle that has been missing, and that has been the 15 Schedule 1 mental health beds for this hospital. And that is what we're going to see part of a more massive redevelopment of this site. So not only are we going to look after the needs of those who have lived in our community with living within the mental health care system, but it's going to continue to serve the citizens for a long time. There's one outstanding item that I hope that we have the opportunity to address as this project moves forward. And that's a standalone dialysis unit for the city and the county. And I hope that as we move forward in the planning that we can see some changes within the renal health network and the LHINs, recognizing that we need a standalone dialysis unit here today. But that's my one political plug. To the candidates that are in this room today, as I leave office, I say to each of you, you need to unequivocally get behind this project. St. Thomas needs this project. Elgin County needs this project. And put the politics aside. Do what is best for our community. Our community deserves this. Our community needs this. The future of our community depends on the success of this project and the important and good work that is done here at the St. Thomas Elgin General Hospital. Thank you all. Congratulations. This is a great day, St. Thomas Elgin. It is my distinct pleasure now to introduce the Minister of Health and Long-Term Care, Deb Matthews. Deb, I've had the opportunity to work with Deb since 2003. I've had the opportunity to see her in a different capacity, sitting in a speaker's chair. And as many of you know, the speaker is often challenged, but I can honestly tell you I have never, ever had to call the Minister of Health and Long-Term Care to order. If only every other member was as well behaved in the chamber as the Minister of Health and Long-Term Care. But she served as the Minister of Children and Youth Services for the province. She represents the riding of London North, and she now serves the citizens of Ontario as the Minister of Health and Long-Term Care. Deb's family has a long history in this area. They go way back. And Deb knows the community of St. Thomas and Elgin County very well. So, ladies and gentlemen, please join me as we warmly welcome Deb Matthews, the Minister of Health and Long-Term Care. Deb, thanks. Thank you so much. This is a great day.
Thank you so much, Steve. I can tell you this is a bit overwhelming for me as I look and I see all these extraordinary people waiting for good news. At least I assume you're waiting for good news. And I don't think I will disappoint you. I want to start by acknowledging Steve Peters. As Steve said, we've worked together since 2003. I can tell you that in one of our very first meetings, Steve rolled out the plan for the divestment of mental health beds. He made it very, very clear to me that I needed to understand, and this is long before I became Minister of Health, that I needed to understand the transformation that was happening in the world of mental health. So, Steve, you are a great friend. You have been an extraordinary advocate for your community. I have more admiration for you than you could ever imagine. And I want to say to all the people of St. Thomas, Elgin, London, thank you for sending Steve Peters to Queen's Park. He has made a remarkable difference. Thank you so much. So this is a great day. We're joined by great people. I want to say to Paul Collins, thank you so much for your tireless advocacy on issues that are important to the people of St. Thomas Elgin. Bruce Babcock, the chair, thank you for volunteering your time to make this organization so fantastic. I want to say thank you to all of the staff. This is a gem of a hospital. I want to tell you that I just had the pleasure of meeting a patient here, a gentleman who had hip replacement surgery and is on his way home today. He's a medical doctor. He practiced in Montreal. He has worked in a number of different hospitals through his career, and he told me that he has never, ever been in a hospital where patient care was such a highly valued attribute. He is blown away by the care that he has received here. He's seen many hospitals. For him to say this is the best is a true tribute to the people of this hospital. Congratulations. I want to say thank you to the chair of the Local Health Integration Network, Jeff Lowe, and the Vice Chair, Linda Stevenson. They have worked very, very hard to make sure we have the right combination of healthcare services in the right place in southwestern Ontario. And I just want to say thank you to you for the work you have done to make today possible. Say thank you to the municipal leadership who is very well represented today. We know that while hospitals aren't really within the domain of municipal governments, we do need those governments to support hospital and hospital infrastructure. I've just come from AMO, the Association of Municipalities of Ontario, where many municipal leaders implored me to pay close attention to the health care in their communities. I want to say thank you to the municipal leaders for supporting St. Thomas Elgin General Hospital. And last and definitely not least, to the volunteers. I can tell you hospitals are the heartbeat of a community. Hospitals are where very important life events take place. It's where little babies are born. It's where our loved ones pass away. It's where important milestones in life occur. It is the volunteers in hospitals who make those very important and emotionally charged moments a little bit easier. And I want to say thank you to the volunteers for raising money, for manning the gift shop, for being navigators to the people who come here. They need the best possible health care, but they also need the best possible care. And I cannot thank the volunteers enough for doing what they do to make this such a wonderful place to come for care. Thank you, volunteers. I want to congratulate St. Thomas Elgin General Hospital, or am I allowed to call it STEG? Yes, thank you. I want to say congratulations to STEG for achieving an extraordinary honor, and that is the Platinum Award for the Quality Healthcare Workplace Award from the Ontario Hospital Association. This is a very coveted award. And what it tells me is that you are working very hard to take care of the staff who work in the hospital, to make sure that everyone who works here is as healthy as they can possibly be. So congratulations. That's a very meaningful award. Yay! government who loves to measure results. In fact, we are a bit obsessed with measuring results because we spend a lot of money in health care, and we want to make sure that we are getting better health care for the people who, after all, are the ones who fund our health care system. One of the things we look at is wait times. Now, under the previous government, wait times were not even measured. We came to office, we started measuring wait times. We knew anecdotally they were far too long. So now we measure, we publicly report, we make strategic investments to drive those wait times down, and you have achieved remarkable results for the people in your community. Cataract surgery wait times have dropped by 62%. CT outpatient scans have gone down by almost 80%. Knee replacement wait times have been cut in half, and you have amongst the lowest wait times in your emergency departments in the province. Congratulations. Now, we are here today to celebrate something new, and I know you can't wait for me to get to that part of my remarks, but I do want to set a bit of a context. You know, ours is a government that really has invested in infrastructure. We inherited a very severe infrastructure deficit, not just in our healthcare sector, but in our education sector, in our roads and our bridges. We came to office in 2003 and started to invest heavily and aggressively in infrastructure. Across the province, we've built or are building 18 brand new hospitals. Over 100 major infrastructure projects are either complete or underway. We really are working hard to rebuild the infrastructure in our healthcare system. Right here in St. Thomas, Elgin, Steve Peters has been, as I said, a tireless, relentless advocate for his community to get St. Thomas Elgin's share of that infrastructure money. And you know what? Steve did way better than getting his share. There are major projects that are underway right now because of the advocacy of Steve Peters. The courthouse renovation, as I understand it, that's a $250 million project, 120 people working at that site at peak of construction, putting people to work in St. Thomas. I know that this is a very, very difficult time for this community, and those jobs are very precious jobs. So he got the courthouse project, and that is underway. He referred to the regional mental health project. That is over an $800 million project. At its peak of construction, 200 workers working on that site. That work started in April and is underway right now. So we like to do things in threes. We got the courthouse, we got the mental health, and just to make it an even three, what I am very, very pleased to announce to you today is that St. Thomas Elgin General Hospital has the green light to go ahead on its major development. Congratulations to everyone involved. I want to make it very clear that this money is in our fiscal plan. This project has gone through all of the steps. It has received Treasury Board approval. That won't mean anything to anybody but a handful of people here. But what that means, it is baked into our fiscal plan. We are moving ahead with this project, and we are moving ahead with this project as quickly as we possibly can. While I am here today to give you the green light, I don't want you to think that there is no work left to do, because in fact the work begins today. There is enormous planning that has to take place because we want to get this project right, and you've got to raise some money because we do look to the community for the local share. In hospital infrastructure, the province pays 90% of the capital costs, 100% for the mental health component. The community, though, provides that 10% share and pays for the equipment and the furnishings within the hospital. So it's a big responsibility to the community, but what this means is that together, working together, we can see this vision a reality. So what does it mean? It means a new emergency department, meeting today's standards that will be able to get people through the emergency department even more quickly, a modern emergency department. It does mean 15 acute mental health beds that are so very desperately needed. It means a modern surgical floor, so that I did have the honor of seeing what is there now, and I look forward to being back to see what is in the future. So it boils down to better care for the people of St. Thomas and Elgin, and I might say London, because we do come here. I know that. So it's a major project. It will bring peace of mind to the people of this community, because we are investing in the future of St. Thomas Elgin. So this is, as Steve said, really the last piece in the puzzle of getting the mental health beds where they need to be. This is a major transformation, providing much better community support for people struggling with mental health issues, but also inpatient beds for those who need that acute care. So I do want to say congratulations. Today is a very special day. I know you've waited a long time for this day to be a reality. This is a project that no one person can do alone. It takes the work of so many people, many of whom are in this room. And I just want to say congratulations and thank you so much for all you have done.
Well, thank you, Minister. I've not had tingly. When my kids were born, I had these tingly moments. I'm having one again. So, I didn't have to go through that. But before I make further remarks, what I want to do is invite our board chair, Mr. Bruce Babcock, up to make a few remarks of his own. Bruce?
Thank you, Paul. Before a project like this can go forward, we have to have the recommendation and the endorsement of the Minister of Health. On behalf of our hospital, all of us, citizens, staff, thank you, thank you. We received a grant to put this project together in 2008, and once that was done, Paul Collins, our CEO and president, has been absolutely tireless in getting together with and doing advocacy with citizen groups, with neighbors, with local governments, with businesses, almost anybody that would listen. And he's just been absolutely a bulldog in keeping this project going. Throughout this process, he's had the absolute unwavering support of Steve Peters. There's just nobody that was more behind this project than was Steve. He got arranged for presentations with various parties, did his own individual lobbying, provided assistance at every single turn. I know Steve was born in this hospital. I know he's been a member of the board of governors of this hospital. He's totally committed to it, and I'm sure it's got to be a very, very proud moment for you, sir. Thank you. Early in last year, Paul Collins and I met with Joe Preston, our MP in this area, and he was kind of kidding Paul a little bit about how long he had worked at this, and he said, I hope this is your time, and he said, I'm here to support you in every way. But also I'd like to mention that St. Thomas Mayor Heather Jackson Chapman and our warden, County Warden Dave Mennel, they wrote personal letters of support to Minister Matthews, as did many of the other mayors and councillors. So they were also very much on our side. Another big factor is the support of our LHIN, Jeff Lowe. Jeff and I are also born and raised St. Thomas guys. A little earlier than Steve. He was in Stag. We're back at the memorial, but it's a great moment for both Jeff and me. So it's been a long journey, that's been mentioned, but with the support that we've had from everybody, we now finally reached this day. This is kind of an important step for St. Thomas. As Steve mentioned, this hospital's been here about 120 some odd years, long before all of us in this room were born. And this announcement today assures us that it's going to be here not just for us, but for the generations to come. So this is a big-time thing for all of us. I think the approval of this project recognizes the needs of the hospital and the needs of the community. It enhances our already strong relationship with the London hospitals and the other mental health partners. It affects everybody in our community. It gives a boost to our community, who've had some struggles with the reorganization in the automotive industry. And when the Ford plant closes in the next 2 to 3 weeks, we will be the second biggest employer in St. Thomas and Elgin County, only behind the combined companies of Magna, Prestran, and Forman. I would like to believe that a key factor in Minister Matthews' recommendation and the support of everybody was the performance of our hospital. And some of that has been mentioned. We've had a balanced budget for the last 6 years. Minister Matthews mentioned the wait times, in not only the various categories, but in the ER. Our patient satisfaction surveys are above the average. And she mentioned the Platinum Award for the quality health care. There were 4 awards given in over 200 hospitals that were competing. The other 3 were Mount Sinai in Toronto, Toronto East General, Trillium in Mississauga, and us. These results have become, in my opinion, are because of the professionalism and the excellence of all of our state employees, our physicians, our nurses, the medical support staff, other support staff, administration, and as Minister Matthews mentioned, of course, our volunteers. This upgraded infrastructure in this hospital now will allow the infrastructure to match the professionalism and excellence of our employees and our volunteers. So now we're going to get a good match, and I can only see this hospital getting better and better and better. Mr. Matthews mentioned there's much work to do, and there is. Me, you, all of the citizens, the businesses, the local governments have now got to pitch in and support this project. And I'm absolutely convinced that we will do that. So thank you again, Minister. Thank you, Steve.
Thanks, Bruce. At this point, I'd like to invite our Chief of Staff and VP of Medical Affairs, Nancy Whitmore, Dr. Nancy Whitmore, to take the stage. Thanks. Nancy.
Well, good morning, everyone. Today is an exceptional day for the residents of St. Thomas and Elgin County, and it's an exceptional day for our healthcare team working here at the St. Thomas Elgin General Hospital. Today marks a milestone for our organization that prides itself on delivering an excellent patient care experience every time. As healthcare continues to evolve around us, our new building will enhance our ability to provide safe, high-quality care to our patients for years to come. This new hospital build will enhance the services that we provide in numerous ways, and I'll highlight a few of these. Our new facility will allow us to incorporate the delivery of mental health care into our day-to-day function in our community hospital. And as 4 out of 5 Ontarians will have family, friends, or colleagues who experience a mental illness during their lifetime, now, when those people need our help the most, we'll be able to provide the kind, compassionate, and effective care they need close to home in an environment here at STAG that will contribute towards their healing. This building will also be home to state-of-the-art surgical suites, where nurses, surgeons, and anesthesiologists will have the newest surgical equipment and monitoring technology at their fingertips to assist them as they continue to perform over 8,000 surgical services every year. And finally, this building is going to house our very long-awaited for modern emergency room. And I know that that is a very exciting statement. I know you saw our surgical services, but if you had gone down to see our emergency services, you would really be anxious to come back, Minister Matthews, and see the new build. Our new emergency room is going to be a markedly expanded space. It's going to be able to provide enhanced care in a welcoming environment to the nearly 40,000 patients who visit our ER every year. So in closing, what today's announcement represents to our physicians and our staff, our community, and most importantly, the patients we serve, is really, truly immeasurable. And I just want to thank everyone who made this happen. It is so exciting. Thanks.
Thanks very much, Nancy. I have the pleasure of certainly welcoming and introducing Jeff Lowe, who is the chair of our local health integration network for the Southwest. And as mentioned earlier, he was accompanied by the Vice Chair, Linda Stevenson, who is from Elgin County, and it's great to have you here. We also have Kelly Gillis, who is the Senior Director at the LHIN with us today, so I want to thank you for coming. Jeff, as Bruce pointed out, has his roots here in this community, but also served for a period of time as the chair of the London Health Science Centre, so is well equipped to understand the importance of healthcare, the importance of infrastructure, of capital investment such as this. So, Jeff, thank you very much for coming, and if you could take the podium.
You know, when I come to St. Thomas, I'm coming home. And it's a great place to have spent a large part of my life. It's a great community. And I would never have dreamt on night after night when I used to come here and pick my mom up, because she worked as a nurse at the hospitals in the 40s and 50s and 60s, and I'm not that old, but I did have my license in the 60s. I had never dreamt that I'd have the privilege of standing before this group today on such a great announcement. It's absolutely overwhelming. One of the real privileges as well as the chair of the Local Health Integration Network for Southwest Ontario is the opportunity to work with the ministry, Deb Matthews, Steve Peters. He's no piker when it comes to health care either, by the way. And the health service providers, whether it's in St. Thomas, in this case with Paul, or across Southwest Ontario. The absolute passion that I've seen for health care since I've taken this volunteer position is outstanding. And I think the LHIN plays an important role in that. We're not a group of mindless bureaucrats doing jobs that don't matter. We're actually adding value at every turn, and I think we're working well with all of our health service providers. And when we have announcements like today, it just makes me feel great. Certainly the mental health part of the announcement today is long overdue. I used to work in the St. Thomas Psych Hospital in the summer. I worked in the canteen, if any of you came by. And I can tell you it was a different operation than it will be going ahead. And the announcement of the beds here at St. Thomas Elgin General is absolutely fantastic. It means that services are going to be provided to allow patients to receive the right care, in the right setting at the right time, and from the right provider. So fantastic congratulations to all the volunteers, the executive, the staff, paid and otherwise, here at St. Thomas Elgin General. Thanks very much to the ministry for the great cooperation. It's been a pleasure working on this project, and we look forward to many more.
Thanks very much, Jeff. And I would be remiss if I didn't say how much the LHIN has been a support for this project right from the get-go, and have done everything that they needed to do to be partners with us. And it's very, very much appreciated. So in sort of closing, Minister, I know that you have been a tireless advocate for quality in healthcare and for improved access, as per our sign behind us. And I think you have shown that in spades. I think the excellent care for health Act is something that you should be very proud of. I think it pointed a lot of us in the right direction to attend to some of the issues that we needed to attend to as healthcare providers. I also know that you're a great advocate for the concept of the healthcare system, that hospitals don't exist in silos, that we are in fact a part of something bigger, which is the patient journey. I also know you're a great advocate for all these people around here, our staff and our physicians, who make this work. These are the people on the front line who provide the care, who make what everybody else contributes to the system actually tick. They're the folks who the patients, when they come into the hospital and their family and friends, they're the ones they interact with directly. They're the ones that they look to for the support and the care and the love and all the good things that go with great outcomes in healthcare. So I want to put a big shout out to our staff and physicians for the support they've shown over the years and the optimism that this project would actually surface and eventually be approved. So thanks to all of you for that. I appreciate that very, very much. I also want to make the point again that, as Nancy said earlier, that the vision this hospital has is to be providing an excellent patient care experience every time. I think we all attempt to do that. It probably doesn't happen every time. Sometimes it doesn't work as well as it ought to. But that is our goal, that it be 100%. And not simply for this hospital, but for the system as a whole. I think that's what people who get into healthcare are passionate about. They're passionate about making that journey the best it can be for all of the family members and friends. And what you have done today, the investment that you have announced today in this little part of the healthcare system is going to have a multiplier in spades to the health of this community and the future of this county and of this province. So thank you from the bottom of my heart and the bottom of the hearts of the people of this county, the patients of this hospital and their family and friends. We appreciate it very much, and we look forward to the future. Thank you. Well, that closes the formal part of our announcement today. Thank you to all of you for attending. I appreciate your support, and as Bruce and others have pointed out, that support actually begins in spades today. So you'll be looking for lots of communication from us in the future, and we look forward to that. So thank you again for attending.